With that, let's start the first session of our course that is on screening for breast cancer for average risk women in the United States. We will have other sessions on the high-risk patient and the MRI screening. My goal is to discuss the latest recommendation for breast cancer screening in the United States. I don't have any relevant financial disclosure. I'm a consultant, but it doesn't do anything with the talk that I'm going to do today. As you know, breast cancer is a heterogeneous family of diseases that mainly involves uncontrolled growth and spread of abnormal cells in the breast. Majority of them are originating from the terminal ductal lobular unit and are ductal in origin, but less common type of breast cancer is invasive lobular that comes from the lobule. The cancers that originate from the other component of breast tissue like a sarcoma or phyllodes tumor are rare. Most common cancer in women is breast cancer, and it's the second leading cause of cancer death after lung. In terms of the number of cases, the estimated number of cases for 2020 includes 280,000 new invasive breast cancer. On top of that, about 50,000 DCIS. And about 43,000 patients, unfortunately, will die from breast cancer in 2021. Incidence of breast cancer has slightly increased in recent years, but it's not that significant. Death from breast cancer has declined. For instance, between 1989 and 2016, that's the latest data that I could find, 40% drop in mortality of breast cancer. At the moment, there are about 3.8 million breast cancer survivors in the United States. That's about approximately 1% of population. And the goal of screening is to find disease at an early stage before it becomes clinically evident so that the cure is possible, cure or control of the disease is possible. Here is the same number of data that I presented to you. The new cases for breast cancer, you can see, is above the prostate and lung and colorectal cancer. When you come for mortality and estimated death, you can see that the breast comes down because of the good treatment and good detection that we have for breast cancer compared to the other cancers. This is a graph showing the incidence of breast cancer per 100,000 women, and that is from a long period of time, from 1940. You can see it was almost flattened, and then at the 1990s, it started to decline. That is approximately the time that widespread screening started in the United States with mammogram. But also, people say that the effective treatment were started to be discovered at that. So a combination of early detection and effective treatment is causing this nice decline in the mortality of breast.